Stimulant Drugs, Cocaine and Deamphetamine in Physiology and Pharmacology by Team 10. Cocaine and deamphetamine are two of the most powerful stimulant drugs that are both extremely potent and addictive. They act to increase alertness, energy, and concentration while reducing appetite and sleepiness. They share similar behavioral effects of quickly impacting brain activity, behavior, and cardiovascular function by altering dopamine activity. These agents act on dopamine transporters, DAT. Cocaine blocks DAT, which results in the inhibition of dopamine reuptake, causing dopamine to accumulate in the synaptic cleft, resulting in a state of euphoria. Deamphetamine increases dopamine release from the presynaptic neurons by inhibiting reuptake of dopamine and reversing the function of DAT. A study was performed that showed increases in DAT levels caused markedly increased maximal rate of uptake that were positively correlated with the uptake inhibition potency of amphetamine, but not cocaine. Cocaine is originated from a South American cacao plant and has a short-lived high lasting around 10 to 30 minutes. It is a highly addictive and illegal substance that has a high potential for overdose and cardiovascular damage. Deamphetamine is a man-made stimulant that is often prescribed for medical use to treat ADHD and narcolepsy. It has a much longer duration of action, lasting 4 to 8 hours. Deamphetamine also has a high potential of abuse, which can lead to cardiovascular issues and anxiety. Deamphetamine is the medical version of cocaine because it's less potent, has a much longer duration of action, and is safe for the body in moderation. Cocaine and deamphetamine should never be taken together at the same time, as this can cause severe cardiovascular issues, extreme anxiety, and psychosis. Understanding how these drugs work helps explain their strong effects and potential risks.
So the drug we're covering is deamphetamine. You might know it better as Adderall or Dexedrine. It's a CNS stimulant that has actually been around since the early 20th century, where it was first used for simple nasal congestion. But now it's one of the most widely prescribed drugs for ADHD and narcolepsy. So the way it works is the deamphetamine enters the presynaptic neuron through the dopamine and norepinephrine transporters, which is the DAT and the NAT. And then once it is in, it triggers the reverse transport. So instead of recycling the neurotransmitters, it's pushing them out into the synaptic cleft, and then it also inhibits VMAT, which causes more neurotransmitters to build up in the cytoplasm, essentially flooding the synapse. And then the overall effect is a big increase in monoamine signaling in the CNS, which is where the focus, alertness, and wakefulness comes from. And then clinically, it is used for ADHD and narcolepsy, and it's taken orally most of the time. A lot of patients are now often on extended release form, which keeps the blood concentration stable over 10 to 12 hours, so there's no big crash midday. That's why this type of deamphetamine is becoming more popular with doctors to prescribe. The side effects are increased heart rate and blood pressure, insomnia, appetite suppression, anxiety. And then one worth noting, there's a real risk of dependence. So even though it's very effective, misuse is also a big concern.
One part of the drug-agent interactions is cocaine. Cocaine is derived from the coca plant. The medical name for it is cocaine hydrochloride. Some of the street names are coke, crack, and snow. The mechanism for this is that it blocks reuptake of dopamine, norepinephrine, and serotonin. It is used very limitedly, and it can be used as a local anesthetic in certain ENT procedures. The different routes of administration for it are being snorted, smoked, and injected. I've included a drawing of a structure of a cocaine molecule. The next one is amphetamines. Amphetamines are synthetic stimulants. Some of the trade names are Adderall, Dexedrine, and Vyvanse. The mechanism for this is increasing the release of dopamine, norepinephrine, and serotonin. Its uses are for ADHD and narcolepsy. And the routes of administration for this one are through oral medications or illicitly being injected or smoked. Some adverse effects are hypertension, tachycardia, anxiety, insomnia, and appetite suppression. And I've also included a structure of amphetamine. The combined mechanism for this is that cocaine blocks the reuptake and amphetamines increase the release. This results in excess neurotransmitters, which leads to strong sympathetic stimulation. It has possible CYP2D6 metabolism effects. The major outcomes for the cardiovascular system are hypertension, arrhythmias, heart attack, and stroke. For neurological, it's anxiety, seizures, and psychosis. And for other body systems, it can lead to hyperthermia and increased addiction risk. Some of the key drug interactions are MAOIs lead to hypertensive crisis, SSRIs lead to serotonin syndrome, and beta blockers increase the blood pressure. Alcohol and cocaine together is called cocaethylene, and it increases cardiotoxicity. Some of the factors that increase the risk of this are the route that it is administered. The IV or smoked route is faster and stronger than the others. Another factor is high dose and the frequency of the doses. Having older age, heart disease or mental illness that you already had, and polysubstance abuse, so using multiple different substances. The treatment and management for this is benzodiazepines for agitation and seizures, cooling for the hyperthermia, careful blood pressure control so you would avoid the non-selective beta blockers, cardiac monitoring, and substance use treatments. The recommendations for this would be to avoid combining cocaine and amphetamines, avoid use with MAOIs or serotonergic drugs, monitor prescribed amphetamine use, and consider patient history. You also want to make sure that you educate the patients on the risks, especially with alcohol use.
Cocaine and D-amphetamine both drastically increase stimulation of the nervous system by acting on the dopamine transporters. Dopamine transporters, or DAT, are membrane proteins located on presynaptic neurons, and their main function is to transport dopamine from the synaptic cleft back to the neuron, a process called dopamine reuptake. Cocaine blocks the dopamine transporters, which prevents dopamine reuptake, while D-amphetamine reverses the function of the transporter to increase dopamine release, which is also called reverse transport, and that forces a large release of dopamine into the synapse. Since D-amphetamine is considered to have less intense effects than cocaine and has a slower onset than cocaine, it is used as a treatment for ADHD and narcolepsy. D-amphetamine has longer lasting effects and a slower onset, so is much more practical to use in the medical setting than cocaine, which has a much faster and intense onset combined with a faster crash, making it easier for people to get addicted to it. Cocaine and D-amphetamine are synergistic with each other, so when taken together, it leads to excess of dopamine in the synapse, which this excess leads to overstimulation of the brain and cardiovascular system, which leads to the vasoconstriction of the blood vessels, which can lead to the symptoms which include high heart rate, blood pressure, and a higher chance of heart attacks. To avoid this, we need to increase awareness for the dangers in using both of these substances at the same time. Patients who are prescribed with D-amphetamine as a CNS stimulant need to be screened for substance misuse and need to have regular medical follow-up to make sure they are not using it for recreational use.